Hi everyone, my name is Dr. Tahir, and I'm going to present on the topic awareness and accessibility of anesthesia emergency trolleys. Thank you for the opportunity. So, in any anesthesia emergency, whether it's an adult airway crisis, pediatric airway problem, malignant hypothermia, or a sudden need for the intralipid, the seconds count. So, the difference between the smooth life-saving response and a dangerous delay often comes down to two things. Do we know exactly where the trolley is, and do we know exactly what's in it? So, with that in mind, our object was simple. First, to see how aware the staff were about the orientation and contents of these trolleys, to check how often the training drills were happening, and finally to identify what's getting in the way and how can we fix it. So we ran a cross-sectional survey with 31 respondents, including anesthesiologists and nurses, covering theaters, ICUs, and procedural areas. We looked at the both numbers and themes, comparing our results to the institutional protocols and safety guidelines. So here's what we found. Most people, about 77%, knew where the adult trolley was. Awareness dropped for the pediatric airway trolley, 65%, and even further for the malignant hypothermia, just 39%. When it came to the contents, the numbers dipped again. Only 36% knew how often the trolleys were stopped. 64% knew exactly where the interlipid was kept. In practice, 65% had used the adult airway trolley in a real emergency. About a third had used the pediatric trolley, and another third hadn't used any trolley at all. Only 13% had needed a malignant hypothermia trolley, and worryingly, just 42% had any formal training or simulation in the past. We also heard about the barriers: limited training and too few drills, trolleys with inconsistent layouts and unclear labeling, physical obstacles like locked drawers and blocked access. So, what's the takeaway? Our awareness and confidence are inconsistent, and the way we store, label, and train around these trolleys isn't setting us up for the success. So, the recommendations are clear: more regular orientations and simulation drills, standardized trolley layouts with clear, visible labeling, easier access, no unnecessary locking or blocking, maps and signage showing exactly where the trolleys and emergency drugs are kept, and finally a follow-up audit in 6 to 12 months to see if you are actually improving. Because in an emergency you don't have time to think, you just need to act. And making sure we know that these trolleys could be a difference between panic and a perfectly executed rescue. Thank you so much.